These exercises are designed for pregnancy and postnatal recovery for your glutes and pelvic stability. So lying on your side, up on your forearm, or you can lay down if that's too much. You're going to do a clam, open that top knee, squeeze your heels together and draw your belly towards your spine. So 10 to 15 of these, keeping your back nice and straight, pelvis still, and squeezing into that back pocket of your bottom. Next, coming up onto your forearm, you're going to lift your hips off the floor, keep your shoulder blade down, press up through those hips using your waist. A progression of this can be with your top leg extended out straight. Otherwise, stay with both knees bent and just try and keep lifting those hips up and down in a nice straight line. Keeping your pelvis nice and level. So 10 to 15 again. And then coming down to lay on your side, supporting your head. We're going to pull your knee, top knee in towards your belly and press your leg away. Again, keep your pelvis nice and level, draw your belly to your spine and breathe. Try and keep a little gap under your waist towards the floor so that your pelvis stays level. Next, extend that top leg, draw the belly in and lift the top leg up and down for pulses or circles with that leg. 10 to 12 if you're doing circles in one direction, 10 to 12 in the other. Punch that bottom out. And then we're going to do an open clam with a leg extension. So open the clam, straighten the knee, fold it back down. Open the knee, extend and back down. Again, keep the pelvis nice and still. Draw the belly to the spine and keep your breathing going. 10 to 12, and you should feel this in your back pocket of your top leg and in the hip region. Rolling onto your back and give that bottom a nice stretch. So up on your forearms, or you can stay laying down on your back. Then doing some bridges with the leg crossed over, you'll feel this stretch into your glute. If this is too much, you can keep both feet on the ground for your normal bridging. Even weight through your feet, rolling up through your pelvis, rolling back down one vertebrae at a time. Try and control this movement through your lower belly. A progression is floating the arms overhead, keeping that nice controlled bridge position with your hips up, squeezing your glutes. 10 to 12 arm floats. And then finishing with some pulses of that bottom. Keep your hips level. Arms can be by your side or floated to the ceiling. 10 to 12 pulses and then finishing with another glute stretch.